Good morning to all of those who make this broadcast possible, our colleagues on the radio who are also broadcasting this briefing, to Manuel and to everyone tuned in to this press conference. Today, 1,061 people are hospitalized in Cuba, 44 are under observation. There are 467 suspected cases and 550 confirmed active cases. Yesterday, 5,002 samples were processed in our various molecular biology laboratories. This number will increase over coming days as more screenings take place and a higher volume of samples are processed, in order to detect anyone and everyone suffering from the virus, many of whom, as we all know, are asymptomatic. 1,771 samples were processed at the Pedro Curi Tropical Medicine Institute, 796 in Villa Clara's Hygiene, Epidemiology and Microbiology Center, 711 in Havana's, 285 in Santiago de Cuba's, 419 in the Almahedas Hospital Laboratory, 376 in the Genetic Engineering and Biotechnology Center Lab, 235 in the National Center for Genetics, 229 in the Civil Defense Laboratories, and 180 in the Fructuoso Rodriguez Hospital. Of the 5,002 samples processed, 60 tested positive for SARS-CoV-2 and COVID-19. That's 60 people. 3,763 samples were studied from Havana, 366 from Matanzas, 182 from Ciego de Ávila, 102 from Villa Clara, 146 from Santiago de Cuba, and so on and so forth from all of the country's provinces. This brings the total number of samples processed in the entire country since the pandemic began to 382,496, of which 3,866, or 1.01% of people, have tested positive for the virus. All of the 60 people to test positive for the virus yesterday are Cubans. 40 are confirmed case contacts. This means that 3,436 people, or 90.3% of all cases diagnosed in Cuba, had contact with someone who had previously tested positive for the virus. Of the 60 cases diagnosed yesterday, the source of infection linked to 3 is yet to be determined. Of all such cases, and those reported yesterday, the source of infection linked to 17 is still being investigated. Yesterday, 17 or 28.3% of the 60 people who tested positive for the virus contracted it abroad, bringing imported cases up to 352 since the start of the pandemic. Of the 60 diagnosed cases yesterday, 29 are male for 50.2% of all cases, while 31 are female, representing 49.8% of all diagnosed cases. 41, or 68.3% of all diagnosed cases yesterday, were asymptomatic at the time of testing, for an overall total of 57.9% of all confirmed cases since the pandemic began in Cuba. If we look at these figures over the last 15 days, the rate is similar, standing at 55.8%. By age group, 9 positive cases diagnosed yesterday, or 15% of the total, are under the age of 20. 6 of the 9 are pediatric cases, meaning patients under the age of 18. This means that, to date, 401 minors, or patients under 20 years of age, have tested positive for the virus in Cuba. 355 of the 401, or 91%, have made a full recovery and been discharged from hospital. Yesterday, 23 people between 20 and 39 years of age tested positive for the virus. 24 are between 40 and 59, and 4 are over the age of 60. Of the 60 positive cases yesterday, 39 or 65% belong to Havana, 4 to Santiago de Cuba, and 4 to Guantanamo, all of which are imported cases. 3 of the cases from Santiago are from the municipality of the same name, and 1 is from Songolomaya. The cases from Guantanamo belong to the municipalities of Guantanamo, with 2, and 1 each from San Antonio and Manuel. Of the 60 cases yesterday, 3 belong to Las Tunas and 3 to Granma. The cases from Las Tunas belong to the municipality of Las Tunas, with 2, and Colombia, with 1 case. Meanwhile, the 3 cases from Granma are from Niquero, Media Luna, and Yara, all of which are imported. Artemisa and Villa Clara have 2 cases each, while Ciego de Ávila, Camagüey, and Holguín each have 1 case. The cases from Camagüey and Holguín are both imported. To recap, of the 60 positive cases diagnosed yesterday, 17 are imported, 4 each from Santiago de Cuba and Guantanamo, 3 from Las Tunas and Granma, and 1 each from Villa Clara, Camagüey, and Holguín. Those were the imported cases. Now, of the 43 autochthonous cases, the result of local transmission, 1 belongs to the municipality of Manicaragua in Villa Clara, 1 to Moron in the province of Ciego de Ávila, 2 to Artemisa and the municipalities of Mariel and Arquiza, and 39 to Havana, 13 from the municipality of Arroyo Naranjo, 6 from La Lisa, 5 from Boyeros, 4 from 10 de Octubre, 2 each from Habana del Este, Playa, and Marianao, and 1 from Centro Habana, Cotorro, San Miguel, Cerro, and Regla. You will recall that the Vice President of the Provincial Defense Council during the Mesa Redonda program yesterday highlighted the high number of cases we have been seeing over recent weeks, which are also widely spread across the city. This has led to the new set of measures for the capital that will come into force as of September 1st. Yesterday's results per province therefore mean that Havana continues to have the highest confirmed case rate per 100,000 inhabitants over the last 15 days. standing at 23.42, higher than yesterday's. Artemisa follows with a rate of 13.01. Then Pinar del Rio with 5.31, both slightly lower than yesterday's figures, but still relatively high. Next is Matanzas with 3.47, Villa Clara with 1.67, Las Tunas with 1.13, Ciego de Ávila with 1.14, Mayabeque with 0.26, and Camagüey with 0.13 per 100,000 inhabitants. This means that Cuba's rate over the last 15 days stands at 5.80 per 100,000 inhabitants, slightly higher than yesterday's. To summarize, of the 3,866 people who have been diagnosed with the virus thus far in Cuba, 550, or 14.2%, are active hospitalized cases. 527, or 95.8%, are clinically stable. No COVID-19 related deaths were reported yesterday, meaning that Cuba continues to have registered 92 fatalities since the beginning of the pandemic, for a mortality rate of 2.37%, which, compared with the regional rate of 3.52% and global rate of 3.41%, places Cuba in 21st position in the Americas and 111th in the world. As I always mention, 2 patients were previously evacuated at the start of the pandemic. Yesterday, 27 people were discharged from hospital, lower than the number of those who tested positive for the virus. 22 from Havana, 2 from Pinar del Rio, and 3 from Villa Clara. This means that to date, 3,222 people, or 83.4% of all confirmed cases in Cuba, have recovered from the virus. Today, 5 patients continue to be in a critical state, with 18 reported as serious, a number that has increased as cases have risen. Yesterday, 3 patients joined the group of those reported as serious, 2 from Havana and 1 from Pinar del Rio, while 1 patient from Havana went from critical to serious and another from serious to closely monitored. Now we are going to turn our attention to the world. As of yesterday, COVID-19 continues to be present in the same 185 countries. Yesterday, 276,147 people were diagnosed with the virus, for a total of 24,204,686 confirmed cases since the start of the pandemic. Yesterday, 6,334 people died of the virus, for a total of 826,090 COVID-19 fatalities and a mortality rate of 3.41%. The region of the Americas, the epicenter of the pandemic for several weeks now, yesterday reported 123,035 new cases, for a total of 12,910,547 confirmed cases. Of the 24 million cases worldwide, practically 13 million belong to the region of the Americas, representing 53.33% of all COVID-19 cases. Of the over 6,000 COVID-19 fatalities reported yesterday, practically 4,000 occurred in the region, 3,953, bringing the COVID-19 death toll in the Americas to 455,000 566, and a mortality rate of 3.52%. Just like yesterday, the United States continues to top the list of countries hardest hit by the pandemic, with 1,228 COVID-19 fatalities yesterday and a total of 5,821,876 confirmed cases. Next comes Brazil with 1,085 deaths yesterday and a total of 3,717,156 positive cases. Then comes India, Russia, South Africa, and from our region, Peru and Mexico, where 626 people died of the virus yesterday. Then Colombia with 295 deaths, followed by Chile and Argentina. This is the information that we have on the behavior of the pandemic in Cuba and the world.